Fine, so welcome all again to this Wednesday. This amazing Wednesday, and let's discuss some MCQs in a very short period of time. So let's start. We are into this week, and you're into this middle of what? In the middle of this whole 2-month anatomy, most comprehensive anatomy MCQ series that you will ever find in a short span of time on any channel, right? So here we into in this embryology and histology part. So this will be today also we'll have a couple of MCQs on embryology, a couple of topics we can say. And from tomorrow, I will tell you that we are going to have daily around 10 important images that we'll discuss on the histology aspect. So around 2 days, we'll have around 20-21 images, right? Fair enough, let's start the session. Here we go. The first MCQ. A 70-year-old newborn with a diagnosis of patent ductus arteriosus, right, PDA, undergoes surgery to ligate the ductus arteriosus. During the repair, the surgeon takes special care to avoid injury to a closely related nerve. The surgeon is protecting which nerve? So the question basically is that can you identify that there is an important nerve that is related to the ductus arteriosus? Because the surgery is being done over here, and when the surgeon approaches this area, obviously it would be very small because it's a 7-day-old newborn. So how big is the heart? How big would be the ductus, and how big would be the nerve? You can imagine. So they ask you, okay, which nerve over there, because the nerve will be very thin, right? Which nerve over there should the surgeon be careful about, not to injure that? What's the answer? The answer for this question is, after discussion, have a look at this particular image, right? Now, ductus arteriosus, or the important arteries coming out from the heart, they are basically what we call them as parts of the pharyngeal arch arteries, right? How many pharyngeal arches are there? Try to tell. There is first arch, second arch, third arch, fourth arch, and sixth arch. And therefore, the arteries are there of each arch. Like for first arch, we have an artery known as stapedial artery, or not stapedial. First, we can say part of, say, maxillary artery. Let me just remove it a bit. Maxillary artery, right? Part of. Second arch, yes, here we have the stapedial artery. First, make small steps is what mnemonic I used to learn for myself. First, make small steps. So first, make is maxillary, is small s. Second, steps is stapedial. Third arch, third is the third letter in English is ABC, so C for carotids. Fourth arch, below carotids, what we have on left and right side, different things. On the left side, we have a part of the arch of aorta. On the right side, we have the right subclavian artery, part of right subclavian artery, obviously. For the sixth arch, again, we have left and right different things. On the left and right, the common thing is both will have the pulmonary arteries, but on the left side, we have an addition of what? Addition of the ductus arteriosus. Therefore, the ductus arteriosus coming from the left sixth pharyngeal arch artery. Have a look at the ductus arteriosus over there. Here are all the arches written 1, 2, 3, 4, and 6. 5 disappears actually, right? So basically, what happens is, the ones I am highlighting with this color, right, maxillary, stapedial, they all parts which come from here, actually they disintegrate to a lot of extent. What is remaining actually is the third arch, fourth arch, and sixth arch artery. You can also see the carotids, the arch of aorta, and this pulmonary trunk, and this ductus arteriosus, they actually remain. Now, if you talk of the nerves of these related arches, you will realize that for the sixth pharyngeal arch, the nerve is what? The nerve is the recurrent laryngeal nerve. Therefore, you can see these are the recurrent laryngeal nerves. Let me highlight them for you. Can you see this green highlighter over here? These are the recurrent. This is right side, that is left side. And as the ductus arteriosus is coming on the left side, we have the left recurrent laryngeal nerve will be the answer. Remember this. It is a very good question. Came recently also in NEET PG. Good question. Topic is pharyngeal arches. Let's come to the next one. Just jump to the next one. A 5-year-old boy undergoes surgical repairs. Again, 5-year-old. The previous question was 7-day, 5-year. Surgical repair of the indirect inguinal hernia. During surgery, a structure in one of the medial umbilical folds appears to be patent. Which of the following vessels directly gives rise to the patented structure? Indirectly or directly, in any way you can say. We can call them as a clinical question, whatever it is. They are basically trying to know what they are asking the examiners is a basic straightforward thing. They're trying to package that straightforward thing into a thing which appears more, there's more palatable or more clinical sense. What they ask is that which vessel gives rise to the medial umbilical fold. If they would have asked like this, it would be a straight line question, but if they're asking like this, it appears like clinical, but the meaning is the same, right? So yes, come back to the question. So medial umbilical fold. So how many umbilical folds are there? Umbilical folds, we have how many? We have a median, single, then we have a pair of medial, and we have a pair of lateral umbilical fold. Where are they coming from? The median is actually urachus remnant from the urinary bladder. The medial which they have asked is actually the umbilical artery. But is there any option like umbilical artery? The answer is no. There is no option like umbilical artery. Then we'll see. The lateral umbilical fold is a peritoneal fold covering the inferior epigastric artery. It's actually a branch from the external iliac artery. Fine. So coming back to the question now, we are stuck over here, medial and umbilical artery. Umbilical artery basically is a continuation of which artery? Umbilical artery will be a continuation of the, yes, superior vesical artery, which is coming from where? Internal iliac artery. Therefore, umbilical artery is related directly to, hence the answer option number D. Got it? Let me show you an image over here. These are all the umbilical folds. Umbilical folds you see on the inside of the abdominal wall. So this is the umbilicus over here, and these are all the infraumbilical folds. In these infraumbilical folds, have a look at the median umbilical ligament, what I told you, urachus. Then have a look at the obliterated umbilical artery. What is this? Medial L, both sides. And this is the lateral umbilical fold. But if tomorrow they ask you supraumbilical ligament, go with the falciform ligament. This comes from the category of the supraumbilical because it is above the level of the umbilical. Supraumbilical ligament, falciform ligament, that is going to the liver, that we should be knowing, right? So that's all the session, guys. So from tomorrow remember, do log in at 8 p.m. 8 p.m. there will be a premiere of the video for the histological images. And again, quick revision, go through our YouTube shorts and Instagram if you can for the quick clinical vignettes. That's all. Bye-bye. Take care. Any queries, do type them in the comment box. I'll be more than happy to answer it. Thank you. Bye-bye.